I want to go back to something you said a few seconds ago about gout, because I'm not sure I understood it well.
Yes.
So if I do a keto diet and I do it well, that can impact my gout
Yes.
in a
In a
negative
good,
way or a
yeah,
negative way?
but it's good. It's good
Okay.
ultimately. So let's think of
Okay.
so again, going back to what I stated. So when you're changing your fuel source from glucose to ketones, which are really the only two main fuel sources we think about. Alcohol is a fuel source, but we're not thinking about that. What happens is your body is not fat adaptive or keto adaptive, meaning it doesn't know how to use ketones, which is fat, as fuel yet. It's just like, now we know if we take our car, which has electric and gas, right? If we're fortunate to have one of those, we know that if we just flip the switch, it'll work. But our bodies are not like cars. You flip from a body that's been used to burning glucose as its primary fuel to ketones, it's not going to know what to do with the ketones yet. It may take a couple of weeks. What's going to happen is you're going to be peeing out all those ketones in your urine. Right. Unfortunately, that's going to compete with uric acid, which is when that builds up, it causes things like gout and uric acid kidney stones. So the goal is, when I'm transitioning and I have a history of gout or kidney stones from uric acid, what you want to do is, first of all, make sure your doctor's aware. And again, if they read those guidelines for therapeutic carb restriction, they would see that listed as something we should be cautious about. Some doctors will just say, well, you're not really taking the gout medicine regularly because you're not having flares. Let's just put you on it for a few weeks so that it'll help. Maybe your body won't make as much. Allopurinol will reduce the production of uric acid, so I don't make as much. Some people would say maybe going down to 20 right away is not a good idea. They'll say, you're at 300 carbs. Let's go to 100. Let's do that for a little bit. And then we'll go to 50 and we'll ease into it. And that'll give your body time to adapt. So you don't ever want to look at these discussions and say, I shouldn't do keto because it's going to flare up my gout. What you do is you say, I need to understand what's happening so I can ease into it. So the things I tell people who are in this category, besides, adjusting their medicines or easing them into it, I say, you're not the kind of person that should be going in and out of ketosis, because every time you do that, you're going to have a risk of a gout flare again. You're going to have to, so why do that? You should probably stay in that state a little bit longer. But I have some good news, because you kind of suggested, why am I going to do all that if it's not making it better? It's making it worse. It actually does make it better. And what they found in research is when you become metabolically healthy, you're kind of in this ketosis state or just in a low carb state, what happens is the inflammation and all the things that would flare up your gout in the first place go away. So in my clinical experience and what I've seen in some of the research, people who eat this way don't have gout flares anymore. So I'll have people who have gout flares a couple of times a year. Hey, doc, I can't remember the last time I had a gout flare. But those are the people who are following this dietary pattern, are consistent with it, not going in and out. And they find that they kind of get their life back, because as you could imagine, some people with gout, it's a disaster. And if you keep having those flares, what's going to happen is that inflammation is going to start to cause degradation of the bone in that joint where it's occurring. Now you have arthritis, which is more chronic as opposed to acute attacks. So your diet can really reduce your risk of having gout flares and put you in, improve your quality of life more than anything.
Okay, perfect. So you just actually walked us into the next topic, I guess, which would be, how effective is keto for arthritis and sleep apnea?
Okay.
And I'm not sure if they're related, but they seem to have all of these ideas right now.
I think they are. I think, why do I call myself the metabolic health doc? Because so many of the conditions we suffer from are metabolic conditions. My wife's dad has dementia. They call dementia type 3 diabetes.
Right.
Cancer cells love sugar as its primary fuel. It's called the Warburg effect. I think the guy won a Nobel Prize. Hypertension, inflammation, we just talked about that. Metabolic. So the chances are, ding, 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 if you give me any topic, it's good chance it's related. So let's talk about sleep apnea, and so many people suffer from that. Now, I've seen amazing results in my clinical practice with sleep apnea. It seems like consistently people who do keto will lose weight because of they're using fat as their fuel, and some of that fat's on their body. They burn the fat, they lose weight. But it also, because of the weight loss, improves sleep apnea. The question is why? And it's kind of obvious, because if people lose weight, some of the areas where we see weight loss is in their neck, right? And when you reduce the soft tissue around the neck, when you think about snoring, right? A lot of times you're snoring because your airway is kind of just too congested. So now you're losing that soft tissue. Your tongue, believe it or not, will shrink as you do this dietary pattern. Your belly has to get out of the way when you're trying to breathe and expand. And so if you have more room to sleep well, expand your lungs, you'll sleep better. So people with sleep apnea who lose weight actually have a path to not even being on a CPAP machine anymore. In fact, that's the only, in my career, I've been doing this, believe it or not, for 30 years this year. I've been a doctor for 30 years. I have never seen a patient personally get off a CPAP unless they've had substantial weight loss. You never want to be a doctor that's like, if you just lose weight, the sea will part and everything will be okay. That's not completely true. If you have really bad arthritis that's been damaged for years and years, there may be some damage that we can't reverse, right? We know the inflammation will be better, et cetera. But I'm telling you something, if you lose weight, you can actually do a tremendous job for sleep apnea. So yes, is keto going to impact sleep apnea? Yes. Number two is arthritis, right? And this is a little easier because arthritis is all about inflammation, right? And there's different types of arthritis. We have rheumatoid, which is really an autoimmune condition. We have osteo, which is kind of overuse. Lupus can cause arthritis. And we talked about gout. Uric acid crystals in your joints can cause arthritis, right? So keto is a beautiful fuel source because unlike glucose, when I spoke at the Symposium for Metabolic Health, once called Low Carb USA, and I talked about the mitochondria. But when you take the mitochondria, which is the energy source for your body, and you give it different types of fuel, the fuel that creates the most waste and byproducts is glucose. So that's like a factory. And you see the smoke coming from the factory. Your body has to get rid of all that smoke. Number two, if I take ketones and use it as fuel, it's like a solar panel. No smoke. It's very effective fuel. And it doesn't give you all those byproducts. So if you have a keto diet, you're going to reduce inflammation. And there's something that some of you guys may have heard of reactive oxygen species, where you have electrons that are looking for partners, and if they don't find a partner, they react. We hear about that with COVID. When you eat a ketone-based diet, you have less of that, which is even less inflammation. So for many reasons, people who have arthritis, which is your personal experience, I think, Violet, they have less inflammation, and it is a great way to use diet as a way to reduce your symptoms. So I encourage people, if you haven't done the experiment, this may be a good way to help with those symptoms. And we all have bodies we've been using for years, and as we get older, we have to give it a break. And if we have to walk and live and function, but we don't have to give that extra inflammation in our joints. And if we avoid that, we can at least stabilize things and in many cases improve things.